Welcome back and thanks for staying with us. The St. Anne's Bay Hospital is struggling to keep pace with the increased patient load at the facility since Hurricane Melissa ravaged hospitals in western parishes, from patients waiting in wheelchairs for almost 48 hours to overcrowding on most of the wards. Now, while the hospital's management team say they have managed to prevent a crisis situation, things could get worse over the coming weeks. Kalisha Williams has our story.
The St. Anne's Bay Hospital has seen an increase in daily visits and admissions since Hurricane Melissa. Already, facilities like the Mandeville Regional Hospital have been operating at crisis levels since October, with resources stretched thin. While things at the St. Anne's Bay Hospital are not as bad.
So we would have seen over 300 patients between October and December seeking health care here due to the damages that they would have sustained in the western region. Of those, 60% of those patients were actually obstetric patients, real patients requiring admission and treatment.
As a result, Senior Medical Officer Dr. Tanya Hamilton-Johnson said there has been overcrowding on most of the wards.
Post Melissa, what we have been seeing is between 150 and 200 patients be registering to be seen in A&E. Now, what that resulted in is an overcrowding in the accident and emergency area, and this was now compounded by the fact that we lost the capacity of a ward.
Patients would be in wheelchairs or on chairs. They admitted waiting to move to a bed. When we look at our data, we are seeing that the length of stay in a wheelchair in the A&E is about between 24 and 48 hours. Is that something that we want? No, we don't like that number. But we have made a determination that a lot of those patients that are in our A&E waiting to be sent to the ward on a bed, it's better to have them here than to send them home.
And so there are not enough bed spaces to support the influx of patients.
There are certain wards, even though we had a 300 bed capacity, like the pediatric ward, you might have available bed, but we can't put adults on the children's ward.
This is the section of the facility that was damaged by the hurricane. But although they have lost the capacity of the ward, CEO of the hospital, Dennis Morgan, said the team has been working strategically to ensure the smooth running of the hospital.
Our 20-bed overflow ward was damaged, and so that is out of commission. So we need to get back the ward back into circulation. That's 20 beds that we are not having to utilize in terms as a ward. However, those physical beds have been moved to other parts of the hospital.
However, as they try to pivot, the doctors, nurses, and other members of staff have been stretched thin. In fact, many have been working double and triple shifts.
We have more staff doing extra hours work. Let me put it that way, doing extra hours of work. Because of the patient load that is coming in. And they do so willingly. Yes, it has taken its toll. And then sometimes we have to say to staff, you know what, take your days off. Go on your vacation.
Also, while there is a field hospital in Falmouth that would ease some of the burden at the hospital, we were told the field hospital is being underutilized because of the cultural mindset where most people simply prefer the main hospital building, which is why people are being encouraged to use the field hospital and even health centers and clinics where possible. Kalisha Williams, TVJ News.